All right, guys. Well, welcome back to another episode of the Fill Me In podcast. It's Injector Jon and
Aesthetic Nurse Nicole.
And we have a special guest on today. We are so excited to have her on, Olivia Salmen. Thank you so much for being here today.
Hi, I'm so excited. We've wanted to do this for a while, so I'm excited we're here.
Yes, we finally got the schedules to all match.
I don't even want to talk about how many times we tried to do this.
I know. Now, Nicole and Olivia, did you guys meet before? Or did
no, we all met at the same time.
Yeah. The Skin Deep Train the Trainer. Yeah.
Yes. Yeah.
So Nicole and Chrissy knew each other, and that's how I met Nicole. And then I feel like you two already knew each other, and that's how we met you.
We actually, me and Jon met at the Skin Beef conference too. Yeah.
In my head, y'all already knew. Okay.
I know.
Yeah.
Oh my God.
It's because we all clicked like instantly.
Yeah.
I know. It really was. It was like love at first sight.
It was literally love at first sight.
I laugh about that with Jon because I walked into that hotel and we like made eye contact and I just like sat down with you for like an hour and we're best friends.
Immediately
like it was
really
love at
was.
first sight.
I gave her the eyes. I go, save me. I'm kidding.
Sit with me.
Sit with me.
And the fact that we all kept in touch and then planned a whole weekend after that, it's so amazing. I love that about this industry.
The most fun weekend ever.
I think about that Nashville weekend all the time. Yeah.
Me too. Truly. We need to recreate it. People chase next year.
For all of you,
yes.
I can't wait because the people listening to this probably, I mean, Olivia, they probably already know you. I can't describe to you. Even when I came home after meeting you a year ago, I came home and my esthetician goes, "You met Olivia Salmen?" And I go, yeah, why? And at that time, I didn't realize who.
Yeah.
Like, I know. Listen, what I love about you, Olivia, you are so humble, and you don't know like the presence that you've had on social media and stuff like that, and just in general in aesthetics. And like when I came home and she's telling me this, she's like, I followed her for years. Like she's an esthetician. She's like, oh, I just love her whole story and this and that. I'm like, well, I got a lot to learn.
Now we're best friends. So.
No, I know. And then even like when we were at the Train the Trainer last year, like we're all like together and you know, people are coming up and they're like, oh my God, I just love your reels. I'm like, oh my God, another person. Like, what is this?
Another influencer.
But I'm thinking, who is this bitch? Like, I can't get over it, you know? And here we are. But
I know. A year later, basically.
I know. But Olivia, like seriously, you're so young. You've accomplished so much. You've been in aesthetics, right, for about 10 years.
Mm-hmm. Yeah.
Right. And I'm in awe of like everything that you've done. And I mean, how did you get into the aesthetic space and how, I mean, obviously I said 10 years, but like just tell us your story a little bit.
Yeah, I feel like I get that question maybe the most because there's so many, I'm sure people reach out to you guys all the time too, like, how do I break into this field? Yep. And everyone's story is a little different. I think for me, what I recommend to most people is what I did essentially, which is you try to get your foot in the door in whether it be plastics or dermatology in some way. Like I didn't start out as an injector and most people won't, because why would a plastic surgeon hire you as an injector and spend all this money training you when you have no experience? I mean, it is a big investment. So I started out on the surgical side of plastics, and I did that for about 1.5 to 2 years, where I was doing pre-op, peri-op, post-op nursing for plastics. And it kind of just introduced me to this world. And back then it wasn't super popular. Like I didn't know I could be an injector when I was in nursing school. No one did that. Everyone went to the hospital. Yeah. So I even just felt lucky I didn't end up on a med surg floor out of nursing school because I knew I didn't want to do that. I was like, oh, this is cush. Like I'm in pre-op, peri-op, post-op. I love it.
Got it.
And so,
I'm so jealous.
Right.
I never had to do it. I know.
Oh
it's like a rite of passage that I skipped, I think.
Right.
But I would be like in a facelift with Dr. Moore, my practice owner, and I would be like helping him sew a facelift. And he one day was just like, Olivia, you're really good with your hands. Like, have you ever thought about being an injector? I was like, no. And so then he kind of just started training me. Like it kind of was put in my lap because he saw my potential, I guess, which was so amazing of him. And then it just snowballed from there. So for a year or so, I kind of did both, where I was surgery and injecting, just trying to learn until I went full injecting. And then that's what I've been doing like the past 9 years.
Yeah.
So it's been amazing. But that's my journey. And so I usually tell people you're trying to break in. Exactly. Try to get into plastics or derm just so you start learning too. Yeah. And then you go from there. Yeah.
And your CAN's certified, right? Like
I'm CPSN.
Right? Oh, CPSN.
Yep.
Sorry.
So that encompasses surgical and non-surgical, where CAN's is all non-surgical. Yeah.
Got it.
Yes. For people listening, that's certified it's plastic surgery nurse, right? Yes, yes, yeah.
So, which was that test was so terrible. I tell everyone it was worse than the NCLEX. It was horrible.
Oh my gosh.
Because there's a whole part of the book that's just on hand rejuvenation surgically.
Oh my gosh.
And I'm like, I don't know how to do surgery on a hand.
Rejuvenation?
Yeah, like,
yes.
Wow.
And the hand is so intricate. The details of the hand.
Yeah.
There's just parts on that I've never even had to use clinically.
Right. Yeah.
But it's on the test. So
yeah.
Yeah. It was an intense test.
That makes sense. I worked for a plastic surgeon before I was doing this too, and he was he did a lot of hand surgery, so it makes sense.
It's hard. That's one of the hardest areas of plastics, I think.
Yeah.
Who inspired you along the way?
So, I mean, Dr. Moore was a big one because he kind of put it in my head, like, hey, you're talented with your hands. And so,
speaking of hands,
the magic. One of the first conferences that he sent me to was Dr. Swift. Like, what an introduction.
Yes.
So it was his it was the aesthetic blueprint is what it used to be called down in Florida. And I went to that, and he is just you've seen him. He's so eloquent.
Yes. Yeah.
And he makes anatomy so like pretty and artistic. And it's not, it's just such a different way to look at anatomy. Yep. And I saw him and I was like, this is incredible. Like, I want to actually be really good at this. Yep. So he kind of just jump-started me wanting to be a really good injector. Years later is when I kind of went into more of this training route where I then got my new passion of, okay, now I want to help others learn how to do it. But I would say Dr. Swift was kind of the first one that made me really love it.
Yeah.
Naturally. And I'm actually, funny enough, I'm going back to see Swift this weekend, and I haven't seen him since 9 years ago.
Oh,
wow.
This will be my first time back. Yeah.
Full circle moment.
Isn't that funny? Yeah. I'm going to New York to see him. Yeah.
Oh,
he has a way of explaining anatomy in such a way to have you understand it too.
Yeah. Yes.
Like I felt,
very digestible.
Yes.
It is.
Yeah. Which is so important. Yeah.
Yeah.
I know. And it's funny too, right? To think like 9 years ago, you were attending things like that. And now 9 years later, you're almost like a part of those things. Olivia has a very great stage presence. She does a lot of conferences and things like that. So tell us a little bit about that. Like, the shows that you do and the presentations you give.
Yeah. So I've been training now with my career for probably the past about 5 years or so. And with that, I feel like it kind of comes down to as well, like your reputation in the industry, obviously your results, you've got to obviously really hone in on your craft. That's another question I get asked a lot. How do you become a trainer? Right. I'm sure you guys get that question all the time.
Oh,
too.
yes. Yeah.
All the time.
So yeah. And that one, I really tell people, I'm like, to become a trainer, I think you need to be asked. I think that it needs to come, and not always, but I think like that's kind of the way it was for me when I trained for Allergan. I was asked to be a trainer. When I trained for Revance, I'm asked to be a trainer. And I'm like, okay, they are seeing that they think I would represent them well.
Just like Dr. Morris saw in you, they saw the potential in you, right? I feel like if you're begging, it's almost not as authentic as like, And
it's okay to want it, even if you're not there yet. And so you can want it. And then if it's not happening, think, okay, maybe I need to get a little better.
Right.
And then maybe in a year you revisit it. Right. So that was kind of my introduction to training was, again, someone put the idea in my head and I was like, oh yeah, maybe I should do that. So then I started training with Allergan and then Revance. And I did some like advisory boards with Galderma and other companies for skin that I think part of being a speaker or a KOL is also diversifying. And so knowing multiple facets of the industry, my knowledge can't only be about filler.
Right.
If I get any other question, am I going to be screwed? So I think it has to come down to lasers, skin, neurotoxin, all of it. So I think that's really helped me with being a good presenter and speaker is diversifying what I learn about in aesthetics.
Can you elaborate more on what a KOL means?
Yes. So, and I think it means a little something different to everybody. Key opinion leader.
Yeah.
So
because I actually just learned what I mean, I literally am seeing all these people on stage doing whatever, but I actually didn't know what KOL was. And I was
like, cool.
with it.
I was like, oh, cool. And then someone goes, no, they're key opinion leaders. Like these are people in the industry that people they're
people
chosen.
Look up to.
Yeah. Anyway, keep going.
Yeah. So KOL, key opinion leader, it's a lot of people that you see that are presenting at conferences and things like that because they are sent by the companies or the brands that they represent to tell the masses about their products and how to use it. They're essentially trusted to teach on a bigger scale how to use those products or the anatomy, whatever it may be. So
because they trust your techniques, they love your outcomes, they know that, right.
Your experience with it.
Yep.
So with Revance, I'm on their international faculty, so I'm a KOL for them. And that's what I did most recently in London. I was there speaking on Daxxify. And so that one was kind of a funny come about. My good friend, Dr. Raul Chetto, he's a doctor out of London, and he's a globally renowned trainer for Teoxane. But he was originally going to be doing the Daxxify talk at CCR, the conference in London last week. And him and I were talking, and he was like, well, you've been using it for 2.5 years. And then I did their prelude trials with Daxxify before it hit the market. So he was like, well, do you want to come and do this? Because he can speak to the science, but in Europe, they don't have it hands-on yet.
Right.
So,
okay.
Right. So then we were talking with CCR, and they were really excited to have me come and give a US perspective on it.
Right.
So that was kind of my involvement with it. So I did that.
Incredible.
And yeah, it was really fun.
Wow.
It was, I love London. So any chance to go to London, I'm like, sure, have me talk about anything.
Yeah.
Twist my arm.
Oh my God. So how do you like speaking, Olivia? Do you like it? Do you genuinely like it? Yeah.
I remember asking Olivia, I'm like, because obviously I've been a trainer, but I don't do any of the round tables. I don't do any of the stage stuff. And I remember being like, Olivia, do you ever get nervous? She's like, no, not at all. She's like, you're born for this. Yeah.
And I certainly did it first with even like small groups. You would get nervous. Now I don't. But the first one of any caliber is nerve-wracking.
Yes, yeah.
Then
the first one of ever. Then you get past it, you're okay.
And when you have, the knowledge like the back of your hand. So it's like, what is there to be nervous about? You know?
Right.
Exactly.
And that's why they're picking you, because you're so passionate about it. And, and they always say it's not hard to talk about something you're passionate about.
Right. And knowledgeable about, because you can just talk, right? If anything, I'm usually too long-winded. I see them in the back of the conference. They're going like this. I'm like, let's go. I only have 2 minutes left. Got it. So I'm too long-winded. But I think with presenting, it is kind of like you either love it or you don't.
Yeah.
It's very much a skill set, whether that's learned or innate. Some people are born with it. Some people really learn how to do it. But I've always really liked it. And what I've learned about myself that I think is why I'm good at it is I've been told I'm good with communication. So I'll have someone come up to me after a training or a conference, and they'll say, I've been told that what you talked about rheology 10 times and it never made sense. And then I word it in a way, I think my verbiage and my delivery is just very helpful. And so that's what I've learned about myself. I think that's why I'm good at it, is because I'm good at delivering.
You can
a message.
articulate certain things. Yeah.
And make it digestible. Kind of like what we talked about, Dr. Swift.
Yes.
If you get too in the weeds of science, people zone out. As much as you want to get in the weeds, it's hard to kind of make it a little bit of both.
Yeah.
So, you learn those things about yourself as you keep doing it. What are my skills? What are my highlights?
Right. And I think like creating that comfortable environment during a training is huge too.
Yes.
I think a lot of people come into trainings with us like so nervous, whether it be that they just don't have the experience or just the, having someone watch you so closely. A lot of them do come in nervous, and a lot of them think, yes, they're shaking, and they thank me afterwards for creating that comfortable, warm environment where they felt like they could ask questions and all of that. And because, you don't want to go in there like quizzing them and putting them on the spot. And
because I feel like they're even nervous just to be in your presence.
Right.
Yes.
Not even like they might have touched a syringe for over 5 years, but they're just nervous to be there.
Yeah.
It's just a situation. Yeah.
I see that so much where I'll see certain trainers like grill the attendees. It's like they're hazing them. And I'm like, no one's going to ask a question. Zero.
Yep. They're not going to feel
so
comfortable.
Scared of
you.
Yep. Where I get questions the whole time. And some of them, they're probably really basic questions to some and advanced to others, and they're just comfortable asking it. So.
Exactly. Yep.
It's very important.
Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
Yeah.
Oh, I love that. Now, during your international travel, you're able to see what people are doing elsewhere, other places, over in Europe and things like that. Like, what do you see hopefully maybe coming into the US that you're hoping to over the next couple of years? Yeah.
So I feel like we're actually starting to catch up a little bit, because we are now doing a little bit more of like the polynucleotide finally. With salmon sperm, all of that kind of salmon DNA.
The PDRN.
Yes. So we're trying. But I think that what we're still missing is more research on that. Like we don't have a lot of info on polynucleotides. We really don't have a lot on exosomes. I'm pretty hesitant with certain exosomes.
I know, me too. Yeah.
I spoke on that in Miami, and I fear that I put the fear in some people about it. And I was like,
you fear mongered.
I did. I really did. Because I'm pulling out articles. I'm like, look at this picture. But it needs it because people trust it blindly. They're injecting exosomes when they should not be because they think, well, if it's beneficial topical, I should just inject it. So,
or the rep is telling them, and the rep has no idea.
Or because Kim Kardashian's doing it, then everyone's got to do it.
It must be good if she's doing it.
It must be good.
Yeah. So, like, we have those things. We don't have enough research on them. So I do appreciate in the US, it's a little strict in that regard of it's not completely the Wild West, but there are things I do wish we had. One that I wish we had is Profilo. And
I've heard about that.
Yeah. So it's just like it's hydrating. So it's like a skin booster, but it does more stimulation because it's stabilized HA. It's like 62 milligrams. It's a ton, but it's not volumizing. It's not meant to be like a cheap
like
filler.
Skin
Right. Yes, you do it really superficial and just kind of do it that way. I've never used it, but I hear amazing things about it. And they have a lot of combined products where it's HA with other things. Like they have Teoxane has Redensity 1, which is your HA, but then it has amino acids and it has vitamins and minerals in it. I'm like, oh, that's nice that you're getting like a combined product.
I know like with Allergan that's coming along the pipeline is Harmonica.
I don't know a lot about it.
Okay. Well, I don't know a ton, but I know that it's hyaluronic acid based, but also has that. What is in Radiesse? It's calcium.
Calcium
hydroxylapatite.
It has that component to it too. So it's stimulating collagen. And I was speaking to a colleague in our industry, and they were saying that overseas, like, especially in Dubai and like other places, that it's actually like it's doing very well. So I think eventually, and I think in 1 or 2 years, that's going to be coming here. So I can't wait for that.
Well, it is. It's such an exciting time to be a part of the aesthetic industry because we're seeing these changes, like I got into it 8 years ago, Livy, you've been close to 10, right? And like, it's like back then I was using Ultra Plus for everything, like
everything.
Oh my God, they were putting it in cheeks.
No, literally, like it was going everywhere. So like now to see how far we've come and like the changes that I've seen, it's like, it's very cool to just see like the advancements we've made.
It's so much more sophisticated now.
Yes.
There's so many options and what belongs where. One other thing with like mixing HA filler with something else, whether it be like the Harmonica or, the RHA 1 or the Redensity 1 that they have in Europe, is that PDGF. So platelet-derived growth factor, mixing that with a filler and injecting it. That's one we can technically already do because we already have PDGF.
There's one on the market.
Mixed products. Ariessence.
Ariessence. Yeah, you used it. I saw you use it. Tell me.
Did you like it?
I love it.
So essentially, I love to geek out on this.
Please geek out on it.
With this, so it's essentially what PRP wants to be. So when you draw PRP, a lot of people don't even know this, but when you're drawing PRP, what you're trying to get out of the liquid gold is platelet-derived growth factor. What you get when you get that gold is about a 4 to 5-fold increase of your PDGF naturally. So you're getting better, like it's increased. But obviously there's variables based off of your health, like how good is the draw. PRP is not going to be very predictable in that way. But usually if you're going to get a good batch, it's 4 to 5 times greater increase of PDGF. With Ariessence, since it's recombinant, it is predictable and it is 1,000 to 300,000 times more potent than PRP. Like that's how concentrated it is. And it's going to be that in every batch. Yes.
Okay. I saw that after you had Moxie or you had microneedling or something, and then didn't you use that for recovery after?
Yes.
To help speed up your recovery process?
So it speeds up recovery, increases, your collagen and elastin on a bigger level.
Right.
Now, could you, and this is, this is like all about like the PDRN and like salmon sperm and all that stuff. Could you ever, is there research coming down along the pipeline saying that you can mix Ariessence with PRP and inject it in the under eyes or the smile lines or do whatever?
So, good question. You just wouldn't need to mix it with PRP because PRP is just a weaker version of Ariessence.
Okay.
And so is Ariessence, is this like a substance already, or are you making this out of the PRP?
There's a substance
so
already.
you don't even have to do a blood
Okay.
draw because it's recombinant. It's like insulin.
Okay.
It just comes.
They
so
were
you
at
have that.
Modern Beauty Con.
Okay.
Nicole, what's his name? Chris
Cardini.
Cardini. Yeah,
Okay.
yeah.
Oh, yes.
He was there.
Because he was with
Remember?
Allergan. Yeah.
Yes.
I have a brochure on it. I almost was like, I actually want to reach out to him to get some samples.
Yeah,
for
no,
here.
that's
Is
crazy.
it FDA approved to inject into the folds and do under eyes with it?
So the thing with
Or not yet?
area essence and with PDGF in general is it just now hit aesthetics, but it's been in therapeutics for 15 years with 4 FDA approvals. So it's been in 5 million patients.
Right.
We just now have it. So that's why I trust it so much as well. They use it in maxillofacial surgery as an implant. They use it for diabetic foot ulcers. Yeah. So it's been used for wound healing for 15 years.
Wow.
Dr. Samuel Lynch just now brought it to aesthetics though, because someone told him he should. So I'm like, it already has the research. It's just new for us.
Yes.
Olivia.
Yeah.
Your devil laugh. I literally miss your devil laugh so much.
It is. It's so evil. I can't help it.
I can't. Sorry. Oh my God. Oh my
I
God.
know.
Well, that's good. So basically, all right, I got you. I'm catching your drift on that one.
But because I don't work with Easy Gel or anything like that. Do you guys have any, like, how does it, I know Easy Gel is supposed to be a little bit better form of PRP. Like, does it compare to that in any way?
So PRF essentially has the same drawbacks of PRP in the sense that it's not able to get that much more PDGF out of it, out of the liquid gold. So you still have that. The benefit of Easy Gel is that it actually adds a bit more volume because it's thick. Whereas with PRP, it's very thin. And then with Area Essence, it's also thin. So Area Essence by itself isn't going to look like filler.
Right.
You can mix it with filler, which is what I like. Or you
we
can
love
do
that.
it by itself. Like if you have an under eye that's just crepey
God, I
and you
want
don't
it.
need volume, you can
just
inject
put it right
the
through
Area
there.
Essence just mixed with like a bacteriostatic saline, right?
Wow.
Hair growth,
Wow.
really nice.
Yeah.
Topically after a halo, you can use it in a lot of ways.
Yeah.
Okay.
Yeah.
I saw when you were overseas in London, there was a talk about lymphatics.
Oh yeah. Yeah. That was really interesting. I hadn't really heard that take on it before.
What did they chat about?
Yeah. So the presenter opened up with saying, he was like, so the lymphatic system is the number one, like under recognized or underappreciated system in the body. We ignore it a lot. And I was like, that's probably true. Like people don't pay enough attention to the lymphatic system in aesthetics and just in regular medicine. And so
unless it's under eye related, right?
Right.
That's
Then
the
we
only time
care.
really
Then we're
talk about it.
worried.
Then we care.
Then I'm puffy. But he was like, it's not just about like water retention. He's like, yes, we know that if you don't have good lymphatics, you're going to get more water retention. He's like, but that's also how we remove the toxins in our body, skin waste. So if you have that backup of skin waste, that causes degradation of your collagen and elastin fibers. So having a good lymphatic system actually upregulates your collagen and elastin fibers.
Makes sense.
Helps with inflammation. When you have a good lymphatic system, you're going to have better anti-inflammatory effects. Right. And I talked about this in my regenerative lecture that I did at AES. Almost every single disease in the human body is rooted in inflammation in some way, chronic inflammation. So if you have anything that decreases inflammation, that's great too. So they came out with this. It's skincare. It's called iRay. I haven't tried it, so I can't speak to it personally. I'm very interested in the idea, but it's IRAYE, iRay. And they found these plant extracts that are natural lymphatic activators. And of course, it's a proprietary complex. They're not going to tell me exactly what's in it.
Of course. Yeah.
But they're acting like it's a new formulation that they have essentially ownership over. So these extracts that they put in it, their research, and I screenshot the article so I could go back and look at it myself, but they're claiming that it can upregulate or activate the lymphatic system by like 250%.
Interesting.
And
the
this
before
is
and afters,
skincare?
yeah, it's skincare. The before and afters looked pretty. So we'll see. I'll look into the research articles that I screenshot more and I'll send it to you, but I'm curious about it. I want to know if it's really doing that much.
Yeah, I just have so many questions on that because I mean, you're putting it on the skin, but the lymphatics are they're deeper. So like, how much is it like?
It must be going after the superficial chains, which aren't as
Superficial chains,
important.
Yeah.
The deep ones do more, but it has to be going after the superficial chains because it's the only ones it would be able to reach, in my opinion.
Okay. This probably would be really good for like puffy eyes, people that have. Yeah. I'm just thinking about that.
Even a component of rosacea. We have anti-redness products, but if you can do even more, I think it'd be interesting.
That's so true. Yep. It actually focuses on like the health of the skin. Yeah.
Olivia, so I want to talk about lip filler with you.
Let's do it.
Yeah. And I want to talk about, because you've been in this field for 10 years, you've seen how all of the techniques have changed, how the different products we've used now in lips, like that we didn't, that we've changed, we used to use, but now we're not using. How has injecting lips changed over the years for you? And what are you doing now? What are your latest techniques?
Yeah. So, I feel like with lips, there's a lot of ways you can do it that would be considered right. It's not just right and wrong with it. I do think like the Russian lip is fading a little bit in a good way. It was so dramatized for a while. But I mean, all it is, the Russian lip technique is essentially just aggressive tinting. That's what it is. It's just aggressive tinting in the lip. So I think that tinting is fine, and I do tint, but I recommend personally, I think it's better to fine tune with tinting in the top lip than doing all tinting. And I say this in my trainings, I say the first couple times you do that patient's lip, if you do all tinting, it's going to look fabulous. As you see them over a couple years, you blow out that border, and then you're kind of chasing your tail. You're going to have to clean it up and maybe dissolve something. And so the first couple times it can be addictive. Too. Yes, exactly. You get more likely to get little bolus with the wet border. So I like it for fine tuning, but I think that when people do it all, they're used to that virgin lip, what it looks like. It's very different on an experienced lip.
Yes.
And I get so many people that come in and, they're showing me the TikToks of like the lips that are taped. Okay. You know what I mean? And they're like, are already flipped and all of that. And they want me to do it. And I just tell them, no. I was like, the lip is not going to stay like that. Number one. And like they look so great in that picture. Then you untape it, they heal and it goes down and the filler is like going up to their nose. Like it doesn't look right. In certain lip shape, it really depends on your lip anatomy.
And I think some people think the more that they come in, the more they can get like a border of the lip. But in reality, the more filler you add, the more we're going to take away from that crisp border.
100%.
Wants it. Yeah. I always tell patients and providers when I train them, I'm like, filler will follow the path of least resistance. So if you have a lip that can't fit more filler, it has to go somewhere. The lip's not just going to magically expand more and more. It's either going to be a filler mustache or it's going to be bubbles in the mucosa. And it starts to project instead of lift. That there is a physical limit on a small lip. Always.
100%.
And it's not just, well, if you come back in a few months, we can make it bigger. Not always.
Exactly. You got to respect the anatomy.
Yeah. And I had a patient that actually she came to me and I've done her lips and we just spot dissolved above, but it's been 3 years. Right. And the lip that we created for her, oh my God, so good. And we had to just minimally just dissolve just above the lip here. And she goes, Jon, I haven't told you, but like for the past year, I had a gua sha and I was just pushing down.
My God.
Filler. And I was like, I can't with you. I literally can't.
And the filler was just going right back up.
She's like, I really think it helped, Jon. I really think. And I'm like, maybe it did, but but I'm like, let's just dissolve it.
Yeah, that's a placebo effect.
Exactly.
It was so
hopeful.
Cute, though.
It's very cute. And you'll get patients like that too. I'll have someone come in. They're like, hey, I think I've got like old filler up above my lip. Can you just add to my border? Just because I want my border to be crisp again. I'm like, no, that filler is sitting like a weight on top of your lip.
On a weight on top.
We got to get that out before I can add anything to your border. It's just going to keep coming out. So,
and weight on your lip. And it's not going to give you that nice lift that you want.
Yeah, it's the Marge Simpson. You get that like hood effect.
The weight prevents it from lifting up. So back to your original question, instead of tinting heavily, I really got off track there.
We always do. I know.
I've almost gone back to what some people would kind of consider the basics. So it's really superficial. Now that's the one thing I think people consistently do wrong is they think they're superficial and they're actually a little bit deep. And then they're in the muscle, which is going to push the filler around. But I go to where my needle blanches. That's how superficial I want to be in the lip. And I tend to do like a chicken foot, a little 3-prong this way. And then
you did not say chicken foot. Now I literally want to vom. Anyway, keep going.
Just a little crow's foot.
Anyway, keep going.
That's usually my first step. And this is for like a non-M-shaped lip. And then for second step, I wish I had like a Q-tip or something. I'll go from the bottom up. I actually like to tint from the bottom up because then you get none in the wet part of the lip. because your entry needle point is in the dry. So you're not going to accidentally shoot product into the wet.
Right.
So I'll go from the bottom up towards the Cupid's bow, and I'll do a 2-prong chicken foot that way and go up and in. And then you get this cross hatching. And I think cross hatching always does better than all lines in the same direction. I don't do a lot of lateral volume. Whenever patients ask me to flip out the edge of their lip, I always pinch them like this. And I say, this is what'll happen if I add a lot to your lateral lip. And then they're like, okay, never mind. So I keep them mostly in the middle. And I usually fine tune with tinting after I've done kind of those two movements. Now, the other technique, have y'all heard of the 4mm technique? Has anyone been doing that?
Is that the Lee Walker technique? Yeah, I actually, and it was Erica. Yeah. Erica Berry. She did on her Patreon. I like watched it and I actually did it. And I think I messaged you, Liv. I was like,
oh yeah,
holy
you did.
shit, like this looks so good. And I was watching the filler, it literally shoot across. I was like, what? This is crazy.
Someone tell me about it, please.
Yeah.
We're leaving Nicole out. So the 4mm technique is with a 4mm needle. You don't have to use a 4mm needle. You could do it with a longer one, but it's helpful for control. So it's about a third of the length of the needle that you're using. So with that, you go in right here, just right at the vermilion border, like at the nasal ala line. You put your needle under the skin and you don't move it forward. It's almost like you're doing a bolus. Okay. But because you're so superficial, you're in that physical vermilion tube and you'll see it blanch and shoot across towards the middle.
Wow.
When you push about 0.1. Now, the benefit of that technique is it's minimal trauma to the lip and you're in the physical tube. The downside, in my opinion, is that sometimes 0.1 of the border is a lot. So if you have a patient that doesn't have good upper lip support, let's say they're older or they have lip lines, that's not my favorite technique for them. Then I would do more of my chicken feet. But if you have someone with a young, naturally full lip like me, I could do that on if I wanted to kind of shoot that across. I think that would be the right candidate.
So to add to your point, I found the same thing. I actually did it on a more I think a woman in her 60s with but she had smoker's lines, things like that.
More mature skin.
It didn't. So I immediately just stopped and I just went to my normal way of doing it. And then someone younger I did, it was just beautiful. I loved just watching.
It's a strong border.
Yeah. But, and to add to your point too, though, I was going and I was watching it and I didn't go to 0.1 because I felt like I was at 0.05 and that was good or
you just watch the tissue and see how it reacts.
How it responds. Yeah.
So you would do that. Top, bottom. So you've got essentially 0.4 in the lip. Once you've done that, again, on ideally a young full lip. And then you can fine tune in the body however you choose. With the 4mm needle, the technique that they talk about is going straight in with that 4mm needle and putting a bolus. I don't love doing that. So I usually skip that step when I do 4mm technique. And I usually will just kind of do some threads into the body of the lip if I need to, but that's the technical 4mm technique.
Yeah. How about an M lip? Are you doing a lot of tenting with M lips?
I feel like I need to tint more with an M-shaped lip because I don't want it to shoot towards the middle beak of the lip.
Yes. Yeah.
So I prefer to do tinting from the bottom up. It's just my preference. So what I tend to do is I pinch the M. So if I press physically on the M and I hold that stability and then I do my tints off to the side. And that way, again, filler follows path of least resistance. Yep. If I have resistance here, it's not going to come to the middle. Right. So I'm making sure I'm not letting it shoot in if I pinch it while I inject. And I go off to the sides.
Yeah, I think that's the biggest mistake I see when people inject M lips is somehow the filler still ends up all in the center.
Because it will go that way, past the needle. Yeah.
And I think too, people don't realize the amount of force they're putting on the plunger of the syringe. And it's, of course, the filler is just going to kind of shoot out. And like you said, go least resistance is going to find that tissue.
Yeah. 100%.
Yeah.
Okay. What about treating lines around the mouth, Liv? Obviously we've learned over the years that it's a multimodality approach. We're not just placing filler in those smokers lines like we used to, and they used to look like freaking a monkey, very
Mark Simpson.
simian,
yes,
literally.
Yep.
Yeah. And so obviously things like Skin Beef have come to play. I know for my patients coming in, I'll do obviously Botox for those lines to weaken the auricularis muscle. I'll do some Skin Beef there. I might transfer whether it's refine or velour, and I'll put them in a BD insulin syringe, and then I'll actually do like micro droplet technique into them.
Yeah.
And I find that actually works really well. It might take a little bit, at least with velour. Sometimes it takes a little bit longer to settle, but Refine kind of just works pretty quickly in those.
Yeah.
And they're super happy. The other thing is too, after they do that, doing like a CO2 or an erbium skin resurfacing laser, obviously just stimulate collagen is a great way. But is that kind of what you're doing too?
Honestly, very similar. Yeah. So the way I talk about it with my patients, because most of them come in hoping you can just do filler there, right? Because it's quick, immediately gratifying, and that's what they want. So I tend to talk about the face as if it's like a 5-layer cake. And so I say, okay, you have 5 layers going on. And this is not just for lips in the general face. I say you have skin, superficial fat, muscle, deep fat, and bone. So if I'm only addressing skin, I'm not addressing what's going on underneath. And so I say, okay, so if I do your neurotoxin, I get to affect the muscle. Okay, I'm only affecting 1 layer of your face. If I do that, that's not the entire root of the problem. So then how do I address the fat? That's going to be my filler. Then how do I address the skin? That's going to be my resurfacing. And so if I kind of break it down in that way, I talk them through why I need to do 3 different things, because there's these different layers I'm trying to address. Same thing with the cheek. When I go after the fat pads, I'm affecting the fat and the bone. And the skin's going to be, again, my skin resurfacing. So with lip lines specifically, I like to start with laser. I would do tox before laser for sure, but I like to start with laser to see how much of the lines can I get rid of before I add filler. And then maybe I'll need less. So if they have the downtime right then, I'd like to start with a laser in a perfect world. I usually do halo. If they're really deep, I'll refer them to our PA that does TRL. I don't personally do TRL, but our PA, Caitlin, does TRL, and she'll do a little bit deeper one on them. Then when they heal up and I can get them back in, then I kind of fine tune with, I'll usually use Redensity. Because Redensity is not really a volumizer. It's more a texture product. So I'm not worried about making them convex. I can keep that concavity and go after wrinkles, and then tox to maintain them. That's kind of my trifecta. That's what I like to do the most. If they don't have the downtime for the laser, we can do filler and tox first. But I word it to them as, hey, I might be able to do less filler on you if you'll let me laser it first.
Right.
I know. I think it's just setting realistic expectations. I mean, Nicole, we just had our previous episode about that. And I think like just saying from the get-go, like, listen, like if you're coming and you have severe sun damage, maybe you haven't smoked, but just like, you know, these people, there's such deep lines. It's lifestyle, right? And it's never going to be an overnight thing. It's a multimodality approach. Like, are you going to be okay with spending X amount of money? And then maybe in a year or two, finally like getting to where we like want to be,
right?
You know?
And we were saying how important it is to like for that education to the patient, like that 5-layer cake you just talked about. That's perfect.
That was huge.
Oh my God.
Love that example. I'm going to use that.
Right. And it just like, it's so easy for them to grasp. Then they understand, oh, that's why. So I feel like sometimes they just think you're trying to sell them 4 different things. But when you explain it that way, it's like, oh, okay, this is why I need these 4 different things.
Yeah. Because again, if you only do laser, because some people want to go just that route, well, I'm not addressing the volume loss or your mimetic movement. Right. You're still going to cause those lines. I've got to do all these different things. Not one thing caused it. Why would one thing fix it?
Right.
I usually say that as well. And
that's great too. Yep.
On board.
Yeah. It's all about the education.
It is. So Liv, what are your biggest like pet peeves, would you say, in the industry, whether it's like what you see on social media or just like in general? What are you seeing?
Biggest pet peeves, I would say I have several.
No, that's okay. Yeah.
I would say one of them is definitely, we touched on it kind of like a little bit.
Okay.
People adopting procedures or providers adopting procedures into their practice that they know very little about because it's trendy. It just gives our industry a bad rep when all of these bad things happen.
Yes.
So something comes out, okay, this is dangerous. Oh, we shouldn't have been doing this. I'm like, do your research before you bring something on. And so often I see that, and I'll be training on something and it's something they've been using for years and they have no idea what I'm talking about.
Right.
I'm like, oh my gosh. So that's a big pet peeve of mine. I don't think you should offer something unless you've done your research on it and you're well versed on it. Everything we do has risks. So know the risks. Even just, you know, NAD is super popular right now. And I think NAD has a ton of benefits. There's a few things you need to think about if you're going to give patients NAD IVs that people don't. They just think everyone needs it. This is good for everybody. There's some mice research that has some indication that if you already have a cancer, could it increase tumor growth?
Correct.
You need to know that. You have to know your patients need that. So otherwise, yes, it has a lot of benefits, but no one knew that when I was talking about that recently.
Oh, Jesus. Yeah.
The room that I was in, no one knew that. And so, you know, things like that. That's a big pet peeve of mine.
Well, and that we do IV hydration here, and I mean, I love it. You know, we do Myers cocktail, we have immunity, and then we have this one called Get Up and Go, which helps with like, increasing your metabolism. I literally want to clean my whole entire house after I have it. But anyway, but with the NED, like we get a lot more people asking about it, and I'm like, listen, like I want to do it, but I want to have like we're going to be expanding here the next 2 years, and I'm actually going to have an IV lounge. And I'm like, when I have that, and I have an RN or an LPN or whatever, like nurses there that I can send for education on it, make sure they're screening, we have the right appropriate questionnaires and all of that. Like that's what I need. You know,
100%.
I don't want to just because it's like you said, it's cool and it's trendy. I just don't want to offer it and not know anything about it. And these poor patients, like I'm sure you've heard of like some side effects to it that people have, and with it, and you just have to be well versed on them.
That's like 100%. So many people ask all of our patients, we're like, are you going to do the medical weight loss for like a year and a half? They're like, are you going to bring it on? And me and Melissa are so Botox and filler heavy that we just don't have the time to monitor people appropriately.
Nicole,
you need someone to head
exactly. Yep. So we brought on Megan, our DNP, and it's all she does. Like she doesn't do Botox and fillers. She is strictly wellness, and she can monitor the patients, draw their blood, make sure everything is safe. And that's the biggest thing. You know, I think in this industry, unfortunately too, a lot of it is greed. And people see they can just get these things online and offer them to their patients for money. And it's sad and it's dangerous.
Yeah. They see it as a quick, easy add-on because you can hook them up to an IV and then go do something else. So And
even with IVs, like like what medications are you on? Do you have kidney disease? Do you have any cardiovascular issues? Also, are you taking a multivitamin daily? Are you on magnesium, potassium? Like, and I'm giving you Myers cocktail that has all of this in it, and then I put you into Torsades. Like, hello.
Yeah.
Like these are but like you just said, like you need to have like the right screening, and like you need to ask these questions before. Like that's a big pet peeve of mine. Can you tell? That's one of my
I think we share that one. We share that love.
You know, I think it's just making sure you're doing things the right way. Right. And like and unfortunately we're in a industry where it's very like people see green, you know, and instead of education and pursuing that. So
Yeah, I agree. I guess one of my other ones, just to keep complaining, I'm just kidding, is I get frustrated with how many people are overdone looking in our industry. And you hate to like say anything about someone's looks, but when it's from things we do, I'm like, you could fix that. And it again, it just gives our industry a bad rep because then you are the expert. You have years of education and you look like that. That scares patients to death because then they just think, well, then that's just what filler looks like. Like that must be just what it looks like if you're that educated and that's what you look like.
So true.
The body dysmorphia is pretty insane in our industry, and it is hard to get past that with some patients that are really fearful. That they understand that they don't have to look that way, but that's a big one is just the overdone syndrome and how prevalent it is among our industry.
I think it's getting better, don't you think?
I think so too.
Like,
definitely.
I do think it's getting better.
Definitely peaked a year or two ago, like maybe even, but now I think, you know, because of a lot of education and people are, you know, I think social media too, I think it's gotten a lot better.
It has seemed to decrease, which is a good thing. But a year or two ago, it was like the heavy Russian lip era. That was kind of the base around it, I feel like.
They walked into the room before the patient. I think so too.
So Liv, so how have you grown your social media presence over the years? I mean, you are obviously an amazing provider, you're, you know, all the things, but like you have the gift of being an influencer and as well. I think that not everybody has that. So how have you, I guess to injectors that are listening, or just in general, if you're not an injector and you're just listening because you love aesthetics and you maybe want to be an influencer, like how would you say you've grown like your platform?
So, I mean, number one, no one wants to hear it, but it takes a lot of time, right? Y'all know this. You have to post so much. You have to be so consistent. I usually post like a grid post 4 times a week, and I post stories every single day. I always joke, like if anyone wanted to kidnap me, it'd be so easy because I post what I'm doing, when I'm doing it. I'm like, at this coffee shop, they're like, so, you know, I do think you have to be
running down to come get you.
I do think you have to be like very adamant with, I'm going to commit a lot of time to it. Number one, you can't just have good content. You have to have consistent content.
Right.
I think the biggest training aspect of social media I try to help people with is diversifying their content. So I kind of do like categories of posts and I go through them in my head of what have I posted recently? Too many of this category, we're switching it up. Because I was talking about this at a dinner program the other night. We were talking about diversifying content. And I was talking about how if you do only trendy posts and, you know, those are the ones that you're hoping go viral because it's a trend, it's fun, they're short videos usually. Those are the ones that are going to get a lot of traction on the individual video, but they usually don't get you a ton of followers. So it's more so kind of individual attention. It gets a lot of likes because it was funny, but people aren't necessarily interested in you as a provider from it.
Right.
That you have to kind of supplement in a lot of education with it too, or post about career development, whatever it is that actually shows you know what you're doing.
Right.
And there was a girl sitting at the table and she was like, okay, yeah, I am trying to grow my social media. And she was like, I have 5,000 followers. And when I post, she's like, I'm doing all these trendy posts and they'll get like 40,000 views. She's like, so in my head, they're doing really well. She's like, but my follower count isn't going up. I was like, okay, that's because no one knows what you do.
Right.
They just see that you're posting fun content. Why would they follow you unless they know more about you and what you do?
You
and
have
what
to
you're
be
good
a
at.
creator.
Yeah.
I feel like you yourself have to take maybe a trend, but then they're like, wait, I didn't see it that way.
Right.
Like,
Does
Don't
that make
just
sense?
copy the trend and do the exact same video. Yeah,
and I think the trends are fun, but to your point, we did the one with the, you know, the crazy song that's playing and you're like, oh my God, change the song. And we got like over 1 million views, but we got like no followers out of it. So it's true. It's like they think it's funny. They're going to interact with it, but they're not going to go to your page and want to interact with you specifically.
Right.
Yeah.
You've got to have something else appealing besides a funny video.
Yeah.
Because I kind of give the example too. I'm like, some of these animal videos, like a funny cat video will get 30 million views. I'm not following the cat.
Right.
I just liked the video. You know, I don't care past that. And so I told her when I was like, okay, what you need to do is add more educational content or more personal content, something where they hear your actual voice.
Right.
And in your first 6 boxes on your Instagram, so before anyone has to scroll, there has to be something catching professionally. If it's all trendy in those top 6 boxes, I think that you're not diversifying enough. So I want, if someone goes to my page after a trending video, the first thing they see is either a before and after or an educational video from me. I need them to click on that first. So that's kind of how I recommend going about it when you're diversifying, apart from just the consistency. And then with trends, they last a week. So if you film, you're like, oh, I found a fun song, I'm going to make a video to it. If you sit on it for 2 weeks, it's dead.
Yep.
So I always say post your trends as soon as you get them, even if you have scheduled content, push that back. Throw your trend in, and then you can get back on schedule.
Right. Right.
Yeah.
Oh, that's a really good point.
Yeah. I feel like that's actually helpful information. I feel like people talk about social media all the time and they just talk about like consistent posting and stories, but not like.
And that's not super helpful because everybody says that.
Yeah.
It's true, but it's not helpful.
Right.
I do think too, not enough people are on TikTok. I think they're intimidated by it because it's a newer platform. They don't understand it. And it is weird. When you first download TikTok, it doesn't know what you like. You see weird stuff on there.
Oh, I report. I go, why is this on my algorithm? A cheetah killing an antelope. Like, where is this? Oh, yeah, don't even. Olivia, don't even. Corey sometimes goes, what the hell is on your algorithm? And I'm like, I have no idea. I think I look at it for 5 seconds and then it becomes a thing.
When you report it though, it edits your algorithm. Yeah. So then it's like curated to you.
You won't see it again.
With TikTok, every trend you see on Instagram was on TikTok 2 weeks ago.
Yep.
And so I tell people that I'm like, if you're ever going to be on the front end of a trend, it's because you're on TikTok. Otherwise you are chronically behind, period. And I think
a lot more people use TikTok as like a search engine than we think as well, because I have like no followers on TikTok and I'm not consistent on it whatsoever, but we still get like one person a week that says they were referred by TikTok.
On TikTok. It's amazing.
And it's like, you're barely on there.
People almost use TikTok the way people used to use Pinterest.
Yes.
In a way.
Oh, yeah.
I will search for things on TikTok that I wouldn't search for on Instagram. Like Halloween costumes. I would never look on Instagram, but I'll look on TikTok. Even things like that. Yeah. It's kind of got a Pinterest flair with it too.
Exactly. Oh, speaking of Halloween, do we have any
Oh my God, you Miss Halloween Queen over here.
I'm so excited.
I can't wait to see what we're gonna.
It'll be a surprise.
Do you have some things in the works?
Of course
she always does.
Jon, I've been planning for this for a year. This is my month. Okay.
The costume queen.
I have at least 2 costumes, maybe a third.
Oh my God. Guys, if you don't follow Olivia, you need to follow her, because I mean, it's insane what she, like, you talk about being an artist, Olivia, like you're so good with
makeup.
Makeup,
prosthetics.
But, literally. A couple of years last year, I'm like, how long did this take her?
No, literally
like 4 to 5 hours. Like, you actually don't want to know. So, okay. So where he said, follow me, don't follow me this week for any professional content. It's literally going to be 5 Halloween posts. So
I love it.
I said diversify, this week doesn't count. This week is just Halloween.
Oh, it's too funny.
Oh, I love it. So Olivia, I know you're so passionate about skin. So tell us how like you incorporate injectables with skincare in your consultations.
So partially it's that conversation of the 5 layers again, where you can drive it home again. Just doing your neurotoxin here is affecting muscle, not skin. So I need the envelope to be healthy too. Otherwise you just have shriveled up paper on top of an immobile muscle. So with the skin component, I really like to create full treatment plans that they can just use throughout the year, because sometimes it can be really overwhelming when you lay out everything they should realistically do. But I just say, this is for the whole year. This is not for right now. You can kind of spread it out how you want. And I think it's easy for them to digest if I tell them exactly what I do. So I tell them what I like to do in a calendar year for my skin. I like to do 3 microneedling in the summer, 3 lasers in the winter. I feel like it just sounds more digestible, where I'm like, I'll do a microneedling every month in the summer because it's low downtime. I can be out in the sun and I'll do my topical area essence with it to give it an extra boost. And then in the winter, I like to do 3 Moxie BBL because those are lower downtime than my Halo. They're still a week, but I do have to be out of the sun and I do swell. So I tend to do them in the winter, and then I will periodically throw in a Halo. Like, I personally haven't done a Halo since 2021. I'm doing one this December, but it's been 3 years. So my yearly.
Liv, we know you swell, honey.
Oh, I know. It's so bad.
That picture? Oh, yeah.
Expect to see that in December again. Yes. You're welcome.
Literally Winnie the Pooh. Like, I was like, oh my God.
Cabbage Patch Kid. Yeah. Literally a Cabbage Patch Kid.
I love it. I love it so
cheeky.
Much.
Yeah.
Oh my God.
So I'm finally doing another one this December. I haven't done one in 3 years, but so I break that down for them. I'm like 3 and 3 for the 2 main seasons. Like, that's pretty doable. It's like you're doing stimulation every other month. Yeah. And then you throw in their hydrofacials, their dermaplanes, anything that they want to do that's like no downtime. But I tell them, like, if you can commit to that, 3 things in the summer, 3 things in the winter, you're ahead of most people. That would be fabulous.
Can you address a little bit, because a lot of people they end up booking their microneedling and stuff for summer, but then they cancel it because of the sun and stuff like that. And I get that. I get that, because they want to be on their boat and stuff. But like you said, the microneedling actually isn't Moxie even safe to do?
Without the BBL, you could do Moxie in the summer too. And I do that sometimes.
And I try to tell, obviously, my patients, these are safe to do. You know, just, wear your SPF, wear a hat, maybe the first couple of days, try to stay out of the sun. But after that, just wear your SPF and you're good. Yeah. So what do you have to say to that?
I agree. And I try to play that up as the benefit. I'm like, you can live your summer life. Don't come in with a sunburn. Like, I'm not going to do that. But if you've gotten some sun, you're a little bit darker than your usual. That's okay with microneedling. And I tell them it's because it's not a heat-based treatment. When I apply BBL heat to you, I'm worried I'm going to hyperpigment you. Right. Moxie is such diffuse heat. That's why it still does well on skin that's tan, because it's not bulk heat. It's diffuse heat. That's also why it does well for melasma. So I prefer microneedling or Moxie in the summer. People can do Halo BBL if they're really diligent with their sun exposure. It's just harder. So I recommend those for summer. Then winter, we go all in. And the way I try to convince people to stay out of the sun for their winter treatments, just in case they have a trip in the winter too, I say, if you have a little bit of color, I just can't be aggressive. So you're paying the same price for the treatment, but I can't go as deep. So if you want me to do a good treatment, be as pale as humanly possible. Yeah. They're like, okay. So I kind of put it back on them.
Like me.
Yeah. I'm like, it's your fault if I can't go deep.
Exactly.
Oh,
put it back on them.
And hold off on your self-tanner.
Yes. No self-tan. That's right. Yes.
It will come off in stripes. Yeah.
Oh my God. I can't tell you, like, I have white walls, as you can see in my office, and literally, like, all my girls here, they all have self-tanner and bronzer. I literally look and I'm like, on every corner, I see bronzer.
From where they run into things?
Oh my God.
That's funny. That's really funny.
Get your magic eraser out and let's get going here.
Oh my God. That's really
funny.
Good.
What are your like favorite treatments as a provider to do at the office, whether it be filler, skin, like what do you your top 2 favorite treatments to do that you just get a high off doing?
So if I was like Desert Island having to pick a treatment for patients, it would always be laser, like 10 times out of 10. But they're not super fun to do because they're in pain and they're red when they leave. So I don't get to see this like nice result for several weeks.
Yeah.
So I would say my absolute favorite thing to do is like structural filler. So like cheeks and jawline are my favorite because they affect so many other things. When I do cheeks, okay, the under eye and the nasolabial fold look better. Great. Your face shape looks better. Chin and jawline supports the entire lower face. It can even make the corners of your mouth look better. Those are my like most gratifying. Those are my favorite areas to do. And then like lips are the prettiest. Like a lot of areas we do, we're like, oh, more contour, more shape. Lips are just objectively beautiful.
Yeah.
And so I just love like how rosy they are right after that. I would say lips are the prettiest right after, even though they're swollen. But cheeks and jawline still my favorite.
Me
my
too.
favorite to do.
Yeah.
It's so impactful.
It's so impactful. It affects too many areas. Like it's just like you feel like you're getting a 2 for or even a 3 for 1 when you do those areas.
Definitely. Definitely.
I have some funny questions to ask you.
Great.
Should we go into those ones?
I really do. Just before we close, okay? So I'm going to ask you some questions and you say like a one or the other kind of thing.
Okay. Oh, fine. Okay, great.
Well, okay. Dog or a cat?
Oh, you know this answer. Cat.
Where's Boo?
Can we
still there?
Oh,
there he
Boo.
is.
There she is.
Hi, honey. Did we wake you up from a cat nap?
Yeah, sorry.
She's not happy because I did that.
I can't. And these questions, I guess that was the only one that was one or the other.
Yeah.
I'm sorry. But what daily supplements do you take to stay healthy?
How much time do we have?
I was just going to say that. I'm like, this is going to be a long one.
Oh, y'all know I'm a freak when it comes to supplements. So I do a shake every morning, and my shake is AG1, which AG1 is live pre and probiotics and phytonutrients, so it has to be refrigerated. I do scoop that, and then I'll do my Armor Colostrum. Jon, you and I have talked about that before. Are you still taking it?
Every day.
Love
every
it.
damn day.
So I do 4 scoops of that in my shake. I've up to 4 recently.
Yeah. I'm doing 2 in the morning and 2 at night.
Oh, you too then? Yeah, 4 a day.
I weirdly love the taste now. I just like dry scoop it and I'm like,
it just tastes like milk.
Love.
It does. Milk. I like it too.
Mm-hmm.
So I'll put that in, and then I do collagen protein, but the reason I do collagen protein is just because I don't do well with whey. Like my body doesn't like whey protein. I don't digest it well. There's some of those studies that say hydrolyzed collagen maybe does have actual skin effect. The jury's out. Maybe it does. But regardless, it's a good protein. So I just do that to get the protein in my shake. And if it has extra skin benefits, good for me.
Right.
And then I put, what else do I put in there? I put spirulina, and then I'll do apple cider vinegar and electrolytes.
Oh, wow.
So it's a nasty little shake, but it's good for you.
She good. She good for you.
Every morning at Olivia's, she's like, here's your cup of electrolytes.
I know.
I'm like, thanks, Mom.
Oh, my God.
I'm like, hydrate. You needed to. I take NMN because NMN is the precursor to NAD. I take that as a pill. And then I take lion's mane and Reiki mushroom extract. They're supposed to help with stress and mental clarity. I actually feel like they really do. I like my mushroom extracts a lot.
Is this all in your shake?
No, these are pills. We've switched to pills, Jon.
Okay.
Pay attention. Pay attention.
What are you like after taking this an hour later? Are you like, are you just like, I mean,
there's no caffeine in it. It's like nothing. It's very much just like a cumulative effect. I feel like I feel nothing from it. I don't know, nothing. I take resveratrol. I take magnesium. I do castor oil wraps. What else do I do?
Wait, on your body, face? Or
I sleep with castor oil on my liver. And I put it on my eyelashes too.
Oh yeah, that's a good like natural lash serum.
Jon's like, she's doing witchcraft now.
No, but like, what is happening?
Yeah.
Do I have to sleep with something on my liver? Is this?
It's really good for detox. So you put castor oil on like this wrap and you tie it around your stomach on the right. And I sleep with it on usually every other night. And it's really good for liver detox. It's good for if you tend to get constipated, it's good for constipation. But it's not like a laxative. A lot of people are fearful of that. And I would be too, because I don't really struggle with constipation, that I'm more so doing it for the liver detox and bloat.
Sure.
So don't fear that it's going to work like a laxative, because it doesn't.
It's funny. You mentioned like, we're not, and this is, I mean, we're all nurses here. So, but like for whey, I can't do whey either. Actually,
the bloating is so bad.
The bloating and like it's gassy, whatever. I just can't do it. So like I stay away from that.
Whey protein actually breaks me out too, because I have such sensitive skin. I get acne from it.
Yeah, I don't like it.
Yeah.
And I think it's a fine protein. I really don't have a lot of beef with whey.
Yeah.
I just think I don't digest it well.
Right. Yeah.
Right.
No, my husband drinks it every morning, but I just can't tolerate it.
Yeah.
Me either. It's not for me.
I just got diagnosed with high cholesterol.
Really?
Guys.
You?
Yeah. My LDL is 151.
Oh,
You're so healthy.
I just don't understand it. I think it's just genetic. But
Has to be.
yeah, and my HDL is like it was 70. It's now 50. I just got all my stuff done. And what else? I think that's it. But I'm just like, my total cholesterol is like 220. So like I'm like, okay, do I have to adopt like a vegan diet? Like what am I doing?
I wonder what are you eating that's like, do you eat a lot of like red meat or like fatty foods?
Can I be honest? I mean, we're all, God, I mean, Olivia, you travel so much. We all travel so much. So like, I really do try. I think the travel is hard on me a little bit. And I think that I end up eating foods I don't want to eat. Yeah. I also think that because I'm up doing so much work for the practice that like, I'm trying to go to bed earlier. Actually, I'm trying to go to bed by 9, get more sleep. And I find if I'm up later, I'm snacking too much, which is not good. So I think it is lifestyle. I need to do some lifestyle modifications. And Corey, of course, is like, you need a statin. And I'm like, not yet.
Not yet. Give me a minute.
Let me just try.
Exactly. You can do it. 100%. Yeah, you can. You totally can.
I'm like that too.
I'm like that weird person that I like to do my labs every year. And if they're not better, I'm like annoyed at myself.
Right.
Like, they have to be better every year.
I know.
That's a great goal.
Yeah.
It's a lofty goal, but that's a great goal.
I know. What are your favorite skin products and what do you do to stay grounded?
So favorite skin products, I switch it up. Okay. You know, just to try new things every now and then. One I've been loving recently that, I just added in maybe 3 months ago is, have y'all heard of Ourself yet?
No.
It's a newer skincare line. It's by the same doctors that created SkinMedica and Elastin.
Okay.
And so they created Ourself. And it's really like good technology. That's kind of what sold me on it at first to even try it. And they use this tiered vesicle release. So it delivers the ingredients like at every layer as opposed to just like deep penetration. So the analogy they gave me is like an elevator. So it's like an elevator that gets off at every floor. And so it lets a little bit of everything off at every floor instead of just taking it to the basement.
Wow. Okay.
Oh, I love this analogy.
I love it. And so they have this HA replenishing serum that I've been using. So it's hyaluronic acid, niacinamide, vitamin C, and it's high enough vitamin C that it's replaced my individual vitamin C I was using. Wow. Because it does this tiered release as well. So it's kind of a 3-in-1, which is nice, just like for less steps.
Especially for travel.
Yeah. For travel. Yeah. I liked it a lot. So I've added that in the last few months. Otherwise, I've used Zeo Retinol Skin Brightener and Bright Alive for years. Love them. And then I replaced my vitamin C. I also use their AOX serum, Zeo AOX for antioxidants in the morning. I like the AOX. And then we have our own private label that I get like my Koji pads from. So just kojic acid is always a thing. And then I tried and true have used SkinMedica TNS Advanced for years.
Oh yes. Yep.
It's just
freaking love
my
TNS.
favorite.
Right? Freaking best.
Yeah. It's so good.
I don't hear any Skin Better in there, Olivia.
I don't carry Skin Better.
Yeah.
So I've tried some of their products. My sister's practice carries it. And so I've tried some of hers and I liked them just fine. I think it's a great line. I just don't use anything of theirs religiously. I've just tried some of their products in general. What's wrong, Jon? Tell me what's wrong.
It's fine.
He's looking at his shelf over there like,
I know. No, my tried and true is TNS. I love
Alpharet, right?
Alpharet's my like love. I use the intensive Alpharet. I don't use Tret. Tret can be at least
harsh
for me.
On my skin.
Yeah, and like truthfully, I feel like some people just can't tolerate a Tret. That's my own opinion on it. But the intensive Alpharet, I don't have any skin irritation or anything with it. I love their Alto Advanced Serum, which is like their vitamin C. And my favorite is the Trio. the Trio is just moisturizer. It's just, it's the rebalance treatment. So it actually, when you put it on the skin, it basically, if you're too oily, it doesn't secrete too much oil, like it knows. And then if you're dry, it actually secretes more oil. So it basically tells your skin what it needs based on its hydration.
Yeah.
So it's kind of nice. So I do love that. And then we carry, I love the CBD mist with Glymed.
It's really good.
Really?
CBD
and if you
mist
suffer, you lose Rosatrol, you said, for redness, do you? Or?
Not anymore. We used to carry Rosatrol. Now we have a Lumiere Calm R. And I use that when I'm more inflamed. I have that as well. Yeah.
Okay. So for my rosacea, I rely on CBD mist, which helps to calm down the redness for me. And then, I don't know. I love it.
I want to try that CBD mist. I might order that.
Yeah. And then the Hyacin Active Spray. That's another amazing one.
That's one of my favorites.
Just to help. It's hypochlorous acid. I mean, it's basically Pearson.
Yeah. Have y'all tried One Skin at all?
No.
I've heard of it.
I've got some samples that I'm going to try, but it's like a peptide powered technology. And I was just curious if y'all have used it very much.
No.
Okay. I'll let you know I like it.
Olivia, talk about your husband.
Luke?
Yes, talk about Luke. We love Luke.
I know. Yeah, Luke has said he feels like you and him are friends now, John, because you messaged him once on Instagram, I think.
Yep, we do comment here and there back and forth and stuff.
I love it.
I just love him. But talk about how long have you? So a lot of people don't know this, but Olivia's married, and where do you live?
Nashville. So we live in Nashville, Tennessee, and we have been married 9 years. We met in college, and we've been here and lived here for 9 years. Well, really longer than that because we lived here during college too. So I've been in Nashville since 2011. So he works in medicine. He's in sales, and so he's more on the transparency and insurance side of medicine. So the boring side of medicine. I work on the fun side of medicine. And we both travel for work a ton. So I feel like we try to really make good on the time that we have when we're in Nashville. And every now and then we can line it up where we're in the same place on
and have like a vacation trips. Or do something.
Yeah. So a few weeks ago we got to do that. We were in Salt Lake for work at the same time. Worked out. Funny enough, when I was flying back from London last week, I just didn't even think to tell him where my layover was because why does that matter?
Right.
And he was like, I ended up telling him when I was landing, I was like, hey, just landed in Detroit. He's like, you're in Detroit? I'm in Detroit.
Oh my God.
I didn't even know he was there. And so he was in the airport at the same time as me.
Oh my gosh.
I just thought it was so funny. I was like, we really need to look at each other's schedules. We don't know what's going on. So,
I know.
So funny.
But what I love about you guys is that, I mean, you travel so much for work. You're very career focused, right? And it seems like he is too. And it's like, I just love your guys' little unit that you guys have, and that you're dynamic. That's what I was looking for.
Very healthy relationship.
When you travel that much, and when you both travel that much, it's it's hard. You gotta make time for each other.
And I feel like, Nicole, you're the same way with your husband. You guys both he's a firefighter and he has a schedule, but you guys both respect each other so much.
Absolutely. And the time we do have together, we try to make the most of it. We always joke. We pass in the night because he'll do 24-hour shifts, and then I'll see him when he's coming home, and then I'm heading to work.
Literally. Just
but we all found people that support our lifestyles and that get it, in our careers, which I love. I think it's so important for people too to find that.
100%
in a partner.
I would not be where I am today without him, for sure.
Yeah. And we always try to do at least one big trip together a year. So in 2 weeks, we're going to South Africa.
Amazing. Oh my gosh.
Yeah.
Oh, good for you.
Are you doing a safari?
Yes. We're going to do 1 week of safari, 3 days in Cape Town, and then 3 days in the wine region of South Africa.
You're going to have a blast.
We try to put together a big trip every year. And that's, you asked about grounding, and I forgot to even answer that question. But I travel so much. I do think I always have to, I try to extend all my travel to have a little bit of fun everywhere I go. Yeah. Otherwise, what's even the point? I could just train in Nashville all the time and never go anywhere. So for example, when I went to London, I went a day early and stayed a day late so I could see my friends in London and not just be there for the conference. Anytime I go out to California, I do the same thing. I'm like, okay, I'm going to stay or go early so that I can see my people. It just makes it more of fulfilling for me because I get to kind of actually live my life while I'm there and not make it just about work. Because for several of my earlier training trips, I made it all work. I was in, I was out. And I was like, that was a nightmare. It was just exhausting.
Mm-hmm.
So I try to really balance that way. When I did Hawaii for work this summer, I worked for 2 days and I stayed for 9.
Amazing. I love it. I love it.
I was like, balance.
Exactly. Exactly.
You always make I always see your workshops. I'm like, God, she still makes time for fun. And that's so important.
I have made sure I incorporate that in because then it gets me excited too. Right. I feel like then I'm like, I'm high energy in the training because I'm excited about what I'm doing the next day.
Yep.
Yes. I think it keeps me fun.
Yeah. No.
In the actual training too.
Absolutely. Absolutely. Yeah.
Yeah.
So Olivia, tell everybody how they can find you.
Okay,
where can they?
So I inject out of Nashville. So I inject Monday, Tuesday, Wednesdays, and then I travel to train Thursday, Fridays through the weekends essentially. But I work at Cool Springs Plastic Surgery. It's out of Brentwood, which is a suburb outside of Nashville. It's a plastic surgery office there. It's where I've worked for 10 years. I've been with Dr. Moore since the beginning of my career. So I've been there the whole time. And otherwise on social, on Instagram, I'm Olivia Salmen _aesthetics. And on TikTok, I'm just Olivia Salmen.
Amazing.
Mm-hmm.
Yes.
I love it.
And her content is so good. Make sure you give her a follow.
All the Halloween content this week.
Yes.
I can't wait for this.
It's going to be so fun.
Olivia, thank you so much for being a guest on this podcast. It means the world.
Thank you for having me. I loved it. I loved just seeing your faces too.
Oh, I know. I missed you so much.
I know.
Yeah, not enough time, but we'll make another trip soon.
Exactly.
100%. We'll plan it out for next year.
Yes.
Well, thank you guys for tuning in to this week's episode of the Fill Me In Podcast with special guest Olivia Salmen. Till next time, thank you so much.
Bye, guys.
Bye.
Bye.